Hi, this is my e-portfolio, and the way I've organized it is by the 7 concept map presentations that we had in class, and then each of them is going to have subtopics that go further in detail. So I'm just going to click on this, and it'll take me to the subtopics. The first one is the concept map number 1, and this is very general OT information. So over here I have the OTPF, and this is also key terms that are important in the OTPF. So things like different domains, the areas of occupation, including the different subtopics, performance skills, and then also key terms associated with each skill. Over here, performance patterns and context and environment. Therapy Ed. Also, I wanted to mention that I included an OTPF link on YouTube. That way, it's just another way to help memorize and help keep those terms in mind. Therapy Ed, this is also a link to become more familiar with the NBCOT. And then if there's any particular areas that I want to work on, or if there's certain topics that I already know that I'm familiar with. So it's just a great reference to look at. Frames of reference. So this is just a few of the frames of reference that we've went over in our classes. So the MOHO, the OA, the cognitive disabilities. I have a visual of the PEO, the EHP, and then sensory integration and developmental frames of reference. And of course, there's a lot more frames of reference, which is why I included a link over here. And I found this website to be super helpful to look up the different frames of reference and exactly how it guides an intervention. So this is just a great tool to use. Okay, concept map number 2, this is more about activity analysis. I'm going to review the different adaptations and grading that goes along with OT activities. So occupation as therapy, I'm just going to click on this arrow over here. So activity analysis, the different perspectives, different types of analysis, how occupation can be used as a means and an ends. What is a good adaptation? What are reasons to adapt? What are parameters that are used? I'll also be reviewing learning. So what does ADLs include? What is limited vision, the different IADLs, medication management, readiness to learn? What are teaching strategies for effective learning? Page Ready Chapter 7. I've also included the chapter names. That way I can also reference if I need some clarification. I know where to go, which chapter to look at and which book. Teaching and learning, identifying a meaningful activity. Of course, this is important for clinical practice as well, so it's good to know for the NBCOT. I'm also going to review different types of learning strategies. What are the different types of learning? What is the difference between procedural versus declarative? Concept map number 3. This one is more about cognition, so I know that when I want to review cognition, I have to go to this specific screen. And these are the different chapters. So the first one is more about evaluation. So what are the possible observable manifestations? What is the human memory like? What are the different cognition domains? The definitions. So it's just a great way to review and become myself more familiar with the terms. Optimizing, so how can I help my patients? Making an intervention plan, the common diagnosis, which I also believe is a great way to study for the NBCOT because there's different diagnosis. Just becoming more familiar with that. What are the different interventions for each one of them? Page Ready, evaluation and treatment. This is also a great way to review the different diagnoses that are common within the population. Concept map number 4. This is about vision and visual processing. This one is Radomski chapter 23. So again, a lot of diagrams, a lot of references. What are the visual field deficits? Exactly what is visual processing? What is scanning? So I'll be reviewing all of these. What is bilateral visual impairment? And the 5 major causes of visual impairment related to aging. Assessing abilities and capacities. So the different procedures for practice, how am I going to screen? What am I looking for in the patients? Visual function, looking at eye history. I'm also going to be reviewing vision assessments that we've also went over in our classes. Interventions and strategies. So what are different strategies that I need to review that are specific to clients with vision deficits? So environmental adaptation, vision therapy, visual scanning study. Concept map number 5 is about motor planning and performance. So these are 2 chapters from Radomski. This is chapter 8. So the hierarchical model, the neurophysiological approaches. I need to review what is motor behavior, what am I looking for in the clients, again, diagrams, predictable sequence, essential nervous system lesions, also really important to know for the exam. The other one is optimizing motor performance. So over here I have the learned non-use cycle, the task-based, task-related approaches, different diagrams for easy reference, the makeup of a muscle, optimal motor performance, Chapter 6, Sensation and Sensory Abilities. Again, lots of pictures, choosing evaluation methods. For sensation, I also have to review the purpose, the neurophysiological foundations of tactile sensation, guidelines of planning assessments. Also really important is the spinal cord, knowing the spinal cord injury. Cortical injury, peripheral nerves, definitely really important to review. Again, there's different diagrams. Over here, there's one of the senses, compensation techniques, exactly how can we help our patients. Assessment and intervention for perceptual dysfunction. So again, all these information that will be helpful in guiding intervention. Okay. Concept map number 7. Radomski chapter 7 is assessing abilities and capacities, range of motion, strength, and endurance. And this is also really important to know for the exam, so it's a good reference to use. So measurement, range of motion, endurance, what are the different definitions? What is the intensity level, the MET level? Just reviewing all those key terms. Range of motion is also really important. another Radomski chapter, optimizing abilities. So this is, over here I have 3 capacities necessary for physical activities: the musculoskeletal system, dynamic moving, diagrams over here, the different classes of levers, which is also important to review, the basic elements of a muscle, so just further going into reviewing and just becoming more familiar with the concepts and understanding them and how they can be applied to clinical practice.